Well, the World Health Organization says that there's been unprecedented success in the global control of malaria since the 1990s.
But in its latest World Malaria Report, it says the gains have leveled off in recent years due to insufficient funding. And in recent months, COVID-19 has added a serious challenge to tackling the scourge of the disease. For how the battle against malaria can be reignited and also what more governments and organizations can do despite constraints posed by the pandemic, we're going to speak now with Dr. Sarthak. He's the CEO of the Asia-Pacific Leaders Malaria Alliance. Good morning to you, Doctor. The first 2 decades of this century have been described in this report as the golden era in the history of malaria control. The world coming together to fight the disease, and we've seen an incredible return on investment in terms of global health. So first off, tell us, what has the world done right?
I think the thing that we've done right in the case of malaria, as was the case in terms of HIV, and in certain regards in terms of tuberculosis, when you think about 3 infectious diseases, is that we've come together as a world. And so we've really thought about how do international actors, countries that have already eliminated this disease, come together with resource-limited settings in a way that is both driven by evidence, that thinks about health diplomacy, and thinks about how to put those things together to mobilize resources in a way that's been tremendously effective.
It's interesting you say the world has come together to fight that, but I mean, when we look at, of course, the COVID pandemic, there's been a lot of division, even within the WHO, seeing the U.S. pulling out and massive funding, in fact, $400 million in contributions from the United States, and China's yet to step up to that. So in your opinion, do you think that those gains that we've made against malaria in the past 2 decades are at risk right now of seeing a bit of a pullback?
Hugely at risk, hugely at risk. And so my comment about what we've been able to accomplish in the last 20 years is really about an unprecedented era of international cooperation and an encouragement of building capacity in low and middle income settings at a scale that we hadn't seen before, and doing it leveraging the best in terms of innovation and technology that exists to battle those diseases, and malaria is no exception. But when you look at what has happened, it is clear that really there are 3 things that we have to do effectively in the case of malaria, but this would apply to most infectious diseases. We've got to be able to detect people, and we've got to be able to know where they are. Detection is critical. Then we have to make sure that the diagnosis is correct once we've detected them. And then we need to make sure that the treatment is sufficient and of the highest quality possible. And when those 3 things happen, we're able to succeed in programs. Now, if you look at what the coronavirus has meant for health systems across the world, and that's the United States, that's India, and that's across this region, it has stretched those systems and challenged them to show how can they do those things. And malaria is no exception. And so when you don't do those 3 things right, that's when you begin to see the kind of cracks that we are seeing now. And so it's too early to tell. The World Malaria Report data is out. It shows a leveling essentially worldwide. In this region, we've had tremendous reductions in terms of greater Mekong subregion. We're talking about 96% reduction in deaths and in excess of 90% reduction in terms of cases. But we need to remember that malaria is not dissimilar from COVID. These are problems that don't understand borders. They don't understand differences in language. They require regional solutions and global solutions. And for us to succeed as a region in eliminating malaria, we have to be able to ensure that we're as strong as our weakest link. That means that places like India, while they have achieved a 1.2 million reduction in cases according to this report, we still have high areas of endemicity in India. We have problems in eastern Indonesia and in Papua New Guinea. And until we address all of those together, we're not going to beat malaria. And that's why we have to keep the pressure on, but we have to do so in an integrated way. And COVID-19 is telling us the same thing. I think we should be cautiously optimistic about the vaccine, because delivering the vaccine to all parts of the world is going to be a tremendous test of our work in global health.
Doctor, earlier you mentioned 3 prongs, the third being drugs, and we know that anti-malarial drugs are absolutely essential in this fight against the disease, but there's growing drug resistance. There's misuse of the drugs, low-quality medicines are on the market, and also inadequate doses of treatment. So how much of a threat does this pose in this fight?
I think the drug resistance issue remains a major threat. But I think it's also important in the greater Mekong sub-region, where we've seen the most drug resistance, to acknowledge the fact that we have made tremendous progress, particularly in regards to the elimination of PFL-CIPRO. And so with that in mind, I think that there has also been, it's important to note, a tremendous focus from the global community. The Global Fund established the largest regional funding facility, the $270 million regional artemisinin initiative to address drug resistance, and that has seen gains. What I think is most important for us to remember is that while we need to think about drug resistance, we also need to be thinking about how do we ensure that quality medicines reach those areas where control is still an issue. As I mentioned, Papua New Guinea, in India, parts of Indonesia. And so substandard medicine, absolutely an important area to address. I think the quality of care, being able to measure the quality of care, is a critical piece in this equation. And to do that, you need robust health systems, just as you need robust health systems to be able to manage COVID-19. And I think the other one really critical fact I want to mention is that a lot of this hinges on really good management of data. And so that means not just being able to manage data at a global scale, at a national scale. It means empowering those who work the closest with the ability to analyze that data.
Dr. Sarthak, just quickly before you go, one thing that's not within our control is, of course, climate change and how the world is heating up. Talk to us about that and the risks that potentially, whilst it's heating up, and that may contain the mosquitoes that spread malaria, but that could lead to, of course, the other danger, and that is the mosquitoes that are spreading dengue.
That's right. Absolutely. And I think that what's happening, I'm really glad that you pointed that out. What's happening in the world, and for those of us who've worked in global health for a long time, is that there is no way for us to address these challenges without an approach that is cross-disciplinary, that requires us to work with our colleagues who understand what the implications are of climate change in particular geographies, and how to adapt and adjust our public health interventions to do so. If we don't think about the climate and the implications for transmission, as you said, not only of malaria, but other vector-borne diseases, we're going to be lost. So we need to be thinking at a community level about transdisciplinary approaches to global health. And that will be the only way forward, and that has to be driven, again, by local data. There are going to be some global solutions, but they need to be tailor-made to the Vanuatu's and other places. Yes.
Dr. Sarthak, thank you for your time today. That was quite fascinating. That was Dr. Sarthak Das, CEO of the Asia Pacific Leaders Malaria Alliance, talking to us.